All right. Thank you, everybody. Welcome, everyone. My name is Umar Waris, and I am glad to be joined here with Matt Musselman and Dr. Charlie Clements on our first interview for the Ideals of Medicine organization. Both Matt and I are class of 2020 graduates from medical school, and I am an incoming intern at the Family Medicine Residency Program here at Mercy Medical Center in Redding, California. Matt and I co-founded this organization, Ideals of Medicine, with the idea to reclaim and elevate what we believe is the true narrative of our profession, which is that there are certain ideals inherent in our oaths that we take as doctors and medical professionals. And those ideals call upon us to serve our patients first and foremost, and not systems and other interests, and that there are people, medical professionals, exemplars of those ideals, and they are not only practicing, exhibiting those ideals in their medical practice, but they're also working to make sure our medical institution and our medical policies reflect those ideals in our oath. And with that said, we are truly honored to be joined here with Dr. Charlie Clements, who we feel is quite the exemplar of these ideals. And Matt, if you could go ahead and introduce yourself and Dr. Charlie Clements, and then we can begin.
Thanks, Umar. So, hello everyone. My name's Matt. I am a medical student and public health student at Touro University. And in a few months, I'm going to graduate and go on to residency as an intern in family medicine at Natividad Medical Center in Salinas, California. And it's my honor to introduce Dr. Charlie Clements. Charlie is a human rights activist and public health physician. As president of Physicians for Human Rights, he attended both the treaty signing in Ottawa and the Nobel Peace Prize ceremonies a week later in Oslo for the international campaign to ban landmines. He has served as executive director of the Carr Center for Human Rights Policy at the Harvard Kennedy School. Early in his career, Charlie worked as a physician in rural villages during the Civil War in El Salvador. He is co-founder of the Salvadoran Medical Relief Fund and Pax Americas, a political action committee. In 1992, he was a special guest at the signing of the peace accords that ended the Salvadoran Civil War. So it's an honor to have you with us. And to start things off with an icebreaker, I'll just start with the first question. You kept a journal while you were serving as a doctor in El Salvador during the Civil War, and you later used that journal to write your book, Witness to War. And I was watching another interview you did recently with AMSA where you mentioned that journaling is a good use of our time during this shelter in place during the COVID crisis. And because one page of journaling can translate and help you draw out 50 pages of memories later on. So I was just curious, do you still keep a journal? And how do you structure your journal entries?
So I no longer keep the formal journal. In El Salvador, that journal was a day-to-day journal. And the motivation to start that journal was not that I was a journalist. Some people do this, throughout their lives. But I was afraid that if I were killed there, I would be accused of being a communist or being a guerrilla. And that was not my intent at all in going there. And so I wanted a record of who I was and why I was there and what I saw and what I experienced. And I have to say, when I came back, so I was there a year and then came back and shortly after began writing a book. And of course, the year in El Salvador was quite stressful. The area in which I worked ended up being bombed or rocketed or strafed every day by American supplied aircraft. And I don't want to over dramatize that, because when you've been in a war zone, you understand that there's a lot of people in a war zone at any moment, and just a few of them are actually endangered at any one moment. So it wasn't like I was in danger all the time. But what I'm getting to is that when I sat down to write the book, I would read a page from a diary and all kinds of stuff would come flooding back that I can only imagine that was kind of obscured by stress, because it was a very stressful year. And I think in times of stress, we tend to put one foot in front of another and move on. and that stuff is lost. And so if you keep a journal, it'll often kind of bring back some of that. And I would encourage you, especially to put your feelings into a journal, because facts you can compare with other people, but your feelings will be very effervescent and maybe disappear, and it'll be interesting to see what you were feeling at the time. So especially during your internship or your whole residency, a very important time to do this so you can look back on it later in life and understand what some of your shortcomings were and where you were able to learn, and it's just a valuable experience.
Thank you, Dr. Clements. I think later on in the interview, we'll love for you to elaborate on your experiences in El Salvador and then the work that you did as a part of Physicians for Human Rights. And I thought before we went into that later stage of your career, I thought we would begin by asking what drew you to a career in medicine, and have you had any mentors or experiences that cemented this decision for you?
I didn't actually. I was brought up in an Air Force family. That is, we moved from Air Force Base to Air Force Base where my father was stationed. And my brother went to the Air Force Academy, and I followed him there quite proudly. Graduated second in my class a few years later, and went to graduate school. And during graduate school, my soccer coach from the Air Force Academy was being sent back to Vietnam for the second time. And he was an old guy to me at the time. He was about 28 and had a couple of daughters. And I thought, wow, this guy's having to go back a second time. And I'm sitting here having the life of Riley, really enjoying myself in graduate school. I had a motorcycle and a fast car and women in class for the first time in 4 years. And I decided that I should probably go ahead and leave graduate school, volunteer for pilot training, do my duty, and then come back to graduate school later because I was needed now at the moment. So this is getting to be a long story, but in the course of the war, I chose a non-combatant role. I didn't want to kill anybody. I chose a C-130 cargo plane. And after about 11 months of that, I began to feel that what I was being asked to do was immoral. I wasn't killing anybody, but I was making it possible for other people to kill each other. And on the day before the invasion of Cambodia, I refused to fly any further missions. I was put in a psychiatric ward for 8 months and eventually discharged with a mental disability, a 10% mental disability. They thought I had a situational depression or reaction. And as I was trying to put my life back together, because I'd always thought I would end up being, an Air Force general, I realized I'd always been oriented to a life of service. So it was pretty easy to switch that to medicine, because I have to say, in the midst of war, there were only two people that I saw that had very positive roles, or two kinds of people. That is the medics and the air rescue pilots. And, in the midst of this really terrible experience of war, these people were always doing something very positive. So I think that's probably what influenced me toward medicine.
I see. So would you say that being so close to suffering, as it is in a war zone, really drew you to something more of a service-oriented career, and seeing the medics provided that for you?
Yes, without a doubt. I had actually traveled to Southeast Asia just before pilot training to talk to a lot of pilots to try to get a sense of who was doing what and what people felt about what they were doing. And at that time, the only people I thought that could talk in any way meaningful about what they were doing were either the air rescue pilots or the medics or the physicians, the nurses, the people who were doing something positive in the midst of this mayhem called war.
Just piggybacking off of that, if you had to try and name them, what are the ideals that you have aspired to? Can you provide examples of how you've practiced these ideals in your medical practice or in your personal life or other professional ventures?
Well, let me first say that I think living your values, whatever you do, whether you're a banker or construction worker or a physician or a PA, I think living your values is one of the hardest things there is in life. And I have tried to do that. After I left the Vietnam War, I made a personal commitment to nonviolence as a reminder of how calloused I had become to the suffering and loss of life that happens in wartime, because you have to continue to do your job. And so that is, as I began the second part of my professional life, being a physician, I began with that commitment. I think at the Air Force Academy, I was also, we had drilled into us the ideas of ethics and honor. And those are vague concepts, but basically that, our honor code was you don't lie, cheat, or steal, nor tolerate among us those who do. And I think that shaped a lot of the values that I had in life as well. And I think as a physician, compassion is terribly important and needs to be the center of the values I think that we bring to medicine. People around the world are applauding healthcare workers right now every day from their balconies, in Spain and Italy and now in New York at 7:30 at night to celebrate their courage. But this is generally what we do day in and day out. We don't do it with the same risk that people are doing it in New York or Italy or Spain right now. They're surely under severe risk, but there's always the danger of infectious diseases in hospitals. There's always the danger that we're going to get exposed to something or perhaps have a needle stick or something else. And so I think that we always operate with some idea in the back of our heads that what we're doing is not entirely risk-free. So there's a selflessness about, I think, the profession that's part and parcel of who we are as healthcare providers. I have been associated with not-for-profits most of my adult life, and the same with medicine. I've never worked for anything that was a profit-making institution for medicine that I can think of. And so I think one of the values that I've brought to medicine is that I believe very strongly that health care is a right, and everybody has a right to health. And that implies certain things as well in terms of who has access to it, what they have access to. And every day as healthcare workers, no matter what setting we're in, I think we can bring those values to bear with people. A few years ago, I was asked to give a commencement speech at the AOA at NYU. The AOA is an honorary medical society. And in that talk to the students, I focused entirely on the issue of dignity, because I think that human rights begins with dignity. If you look at the Universal Declaration of Human Rights, it begins with the dignity and worth of every human being, and I think medicine should begin and end there as well. And there's a lot we do in medicine that takes dignity away from people, and I think sometimes the patient-physician encounter, if you can restore that dignity, you can have a much richer and often more positive interaction. And so I would often tell people about my work in El Salvador that I think that sometimes most of what I did was give people hope and some dignity, and then their bodies did the rest in terms of what medicine was able to accomplish.
Powerful. That's tremendously inspiring and powerful. Dignity as where medicine begins, and perhaps our primary role, one of our primary roles as physicians, offering that dignity and hope. Dr. Clements, earlier you had mentioned that compassion and selflessness is also built into our profession. Right now, we're seeing it much more in the spotlight, currently given the current pandemic, but it's always been a part of our profession. This brings us to our next question. How do we maintain meaning and joy in medicine over the course of our long career that we cannot be expecting to be lauded every single moment of our medical career? And people do run into compassion fatigue, and we hear so much about burnout. So what would be your advice of maintaining that meaning and joy and maintaining that compassion and selflessness in our careers?
Well, let me begin by saying that I don't think it's possible at all for anybody in a place like New York City right now, or Madrid, or Northern Italy, to be able to do any of this stuff. But I think we have to try to take care of ourselves. We may not be able to do that always in the short term, like in Madrid or New York right now. Those people are having to work through horrendous shifts and emotional and physical toils. But by and large, I think if we don't take care of ourselves, we will not be effective practitioners. And part of that, taking care of ourselves, is finding ways to hang on to joy.
Mm-hmm.
And for some people, that may be meditation. For other people, that may be jogging. It could be being outside with nature. It could be being with friends. But I think we have to find ways to build that into our professional and personal lives, or we won't be very effective as physicians. So I think that's a place to start, is that we have to find ways to take care of ourselves. And that means recognizing our own needs. And I think physicians are pretty bad for the most part at doing that. And so I know myself, I've been subject to depression, and often coming out of that depression, the beginning of it is saying to myself, I'm really depressed. At that point, you can seek, pharmaceutical intervention, or you can seek counseling, or you can just sit down with yourself and try to understand it. But with me, it always begins with saying, I'm depressed. And so I mentioned that as I think self-awareness is an important part of taking care of yourself as well. And we should try to do that. And sometimes as an intern or resident, it's really tough to do that with the number of hours and the conditions you're working under. But I think we have to do that.
Thank you.
Thanks
So
for that.
self-care is something we're not taught in medical school. That means, the right amount of sleep. It means eating well. It means maintaining relationships. I demand a lot of work. I think work should be satisfying. I think when possible, it should be a source of income. It can be a source of friendships and should be. I think there are many, many things, and a source of laughter and joy as well. And I think if we bring those things to the workplace can give us back some of those things as well. So I put a lot of demands on my work life.
Putting those demands while at the same time practicing self-care and having self-awareness, as you were saying.
Yes.
Mhm. And of course, currently, given this pandemic, I know for so many around the country, particularly places like New York or Madrid, there aren't much opportunities to practice that, unfortunately, because of the crisis. But we hope that as it improves, there are areas where these medical professions can be taken care of just as well and just as much during this crisis too.
Absolutely. And I think that there are times when you can't do those things because you have to work through, because maybe you are in a war, and literally people are in a war in New York and Madrid and New Orleans and all of these places right now. But there are times when you have to kind of push on because there's no other choice. But when that moment ends, you can retreat, reflect, and restore yourself.
That makes a lot of sense. And Dr. Clements, in your answer, you also were sharing how there are parts of the system that sometimes make it difficult. as well when it comes to living true to the values that drew us to medicine and that medicine is about. And I think that leads perfectly into Matt's next question that he'll have.
Yeah, just another point that comes to mind as well,
Mhm.
that because of the fulfillment that many people are, from not always, but often able to find in their workplace, a lot of folks right now are lacking that fulfillment because of the loss of their jobs.
Hmm.
Um, and because they're, being told that their work is not essential. And any and anyway, the next question I have is, with changes in technology and the rise of the medical industrial complex, how do you feel the practice of medicine and its ideals have changed? Has the system failed our ideals?
Well, the question, has it failed our ideals, is a big one. I think the question maybe could be rephrased: have we allowed it to trample our ideals? Because I think we have to defend those many times. But I will say, for instance, I have a friend who was a resident with me, who went to work for an HMO in Seattle, a very famous one up there. And after about 3 years, she was called in and said, you're spending 11 minutes with established patients, and you're allowed 12 minutes for a new patient, but you're regularly spending too much time in your patient encounters, and you need to be more efficient.
Hmm.
That's a big way that medicine has changed. That efficiency came down to someone measuring how much she was paid and how much income she was generating. And I think that there has been a significant shift toward that in recent years, and I think that has made medicine much more complicated. And the fact that medicine has become so expensive, an overnight in an ICU can easily cost $36,000. Someone could step off a curb and break their ankle and end up one night in the ICU and then be out, or one night in an expensive hospital bed. And it's the leading cause of bankruptcy in the United States, a personal bankruptcy. That's contrary to what medicine should be about as well. And so the systems that we have set up or that have evolved, often driven by financial issues, do make it hard to live up to our ideals as physicians.
Hmm.
And so some of these issues you raise are long-standing issues that have been sort of, worsening over the past several decades. Do you feel like in this moment with the COVID crisis that these are becoming even more apparent to others in this field?
Oh, I think, Matt, it's a great question, because if you look at the history of pandemics, they seek out the seams in society where the poor and the marginalized exist.
Hmm.
That's whether it's the bubonic plague, or whether it's cholera, or whether it's COVID-19. This is where they operate, and so it exposes our fault lines. And I think that some people smarter than myself have often said that epidemics kind of reflect a relationship of society as a whole.
Hmm.
Uh, because those that are on the margins get left behind, generally in epidemics, and it makes our fault lines very visible. So the answer to the question, yes, Matt, I think it will do this, and is doing this right now.
And we're seeing it with racial disparities,
Absolutely.
outcomes of this pandemic in particular.
And I think right now, at the moment in I believe New York City, 1 out of 2 people who are dying are African American or of African American descent, and I think that speaks to pre-existing conditions, their access to the healthcare system, and also the system's response to their community, which may be marginalized as well.
And Dr. Clements, I was speaking to somebody earlier, and they had mentioned that that crisis should be an opportunity for reflection and action. Unfortunately, it's slower than we would hope. And how would you recommend, as somebody who has been on the front lines of advocating for patients and advocating for policy change, how would you say we come out of this crisis and be leaders in change?
Well, I think that if you look back at pandemics over history, they have always resulted in significant changes. And the writer Arundhati Roy recently published an op-ed in the Financial Times that talked about pandemics as portals to new worlds. And what she was talking about is that pandemics invariably bring about some very significant changes. What those are a little bit unpredictable. But for instance, in the great yellow fever epidemic in let's see, somehow I've lost my video. I'm going to try to bring that back. So in the yellow fever epidemic in Haiti, that occurred about the time of the slave rebellion there. And Napoleon sent troops there to quell it. And the troops that came from France were not immune to yellow fever, but the slaves there and the slave revolt had been exposed to it, all of their lives, and they had a kind of immunity, and so it decimated the French soldiers, and the slaves won that rebellion. Ultimately that led Napoleon to decide he was going to give up on the New World, on his aspirations there of planting his relative in Mexico, and it led to the Louisiana Purchase, the United States. So pandemics can lead to huge changes, but they're kind of unpredictable, and what we have to see them as opportunities to affect change, and we need to really make sure that we do that in the course of this pandemic, and it'll be things that happen at a local level and things that happen at a national level, and what we're seeing is an unprecedented, I've read, level of international cooperation, which of course the world needs to lead to anyway. But the pandemic has provoked that, and hopefully some of that will stay afterwards. And I think countries that pretend to pursue their own interests, like the U.S. appears to be doing so much in the world stage right now, will be called out about it, and it will be obvious to the rest of the world. But I think that that's a change that's already started to happen in this pandemic, that, as I've read multiple times, there's an unprecedented level. So on January 12th, the World Health Organization released I'm not sure if it was the DNA or the RNA sequence of the COVID-19 virus, and scientists around the world began working on vaccines and other measures to understand it better. Things like that have never happened before. So that's an example of what can come of the change in a pandemic.
Thank you. And this leads to our next question, Dr. Clements, is that unfortunately in medical school, we do not get too often formal education in the history of our profession's role in leading social change. In fact, it has been more than just de-emphasized, but sometimes even ostracized when we think of physicians as agents of social change. In your work as a human rights activist, what hurdles have you encountered, and how can medical education be reformed so that social change is part of our responsibility as well?
Well, first of all, let me say that medical education is always changing and needs to change. I think when I was in medical school, which was in the mid 1970s, we were told medical knowledge doubled about every 25 years, and now I'm told it doubles about every 5 years. And so the amount of information coming at us is just overwhelming, and medical education needs to change to keep up with that. But when I was a medical student, we advocated for and were able to establish courses in medical ethics, courses in death and dying, courses in sex and medical care, courses in intercultural health care. We introduced about a dozen courses in our medical school, which is quite a progressive medical school. I went to the University of Washington. It was a great school, but they didn't offer regular courses in those topics. And so we would introduce them as electives. And if they were successful as electives and the students showed a lot of interest, then some of that would work its way into the curriculum. And I think that medical students have been doing this for as long as there have been medical schools. And so I think we need to continue to do this as well. And understanding the history of medicine is a terribly important part of becoming a physician, I believe, and knowing how these changes have taken place. And the fact is that the medical profession as a whole is pretty resistant to change. I think we all think of ourselves as pretty open-minded and progressive, but if you look at the case of the bacteria that causes ulcers, for instance, an Australian physician posited this and was completely ridiculed by his colleagues to the point where the only way he felt he could do the research he needed was to use himself as an experiment, and he inoculated himself and was able to eventually prove that ulcers were caused by a bacteria. Now, I've actually had peptic ulcers before, and I know that mine were not related to stress, but that's what I was told all the time. And the idea that an ulcer would be caused by a bacteria was such hearsay that this guy, I think he eventually shared the Nobel Prize, but for 7 to 10 years, he really suffered as a result of trying to bring to the attention of his colleagues a very common ailment that was caused by a bacteria, not by stress. So we can find lots of examples like that. And it often takes a lot of work to change the mind of our colleagues.
These examples that you bring of both students reforming their curricula as well as physicians taking bold action, like exposing themselves to a dangerous, pathogen in order to prove some scientific fact. Both of those are kind of going against the grain. Would you say that you identify as an activist? And would you just remind us maybe of how did you begin your activism?
Well, I certainly considered myself an activist, but I was never an activist until I got to medical school. I did refuse to fly further missions in Vietnam, and I was put in a psychiatric ward, but I never really became part of the anti-war movement. So I think my activism began in medical school, and it probably began by recognizing that there were courses that were not taught. Now, I was older when I went to medical school. I was 30, and a lot of medical students at that time were right out of university or college, so I was a little bit older. But I think it began by recognizing that there were courses, that there were things being left out of the curriculum that we needed to learn about, and helping to start a number of those courses I mentioned. I also was very involved early on in the lobbying that led to the National Health Service Corps, because I thought it was a great idea to offer to pay for students' medical school in exchange for years of service in underserved communities. I also was involved with the efforts to separate the American Medical Student Association from the body that had created it, the AMA. And at the first AMSA convention I went to, there was a huge battle over changing the name from SAMA, Student American Medical Association, to AMSA, to get away from the association with the AMA. So medical school was a very rich time for me. I think in part because I was also learning about social justice at the time. You know, I had a patient who was I had worked in the shipyards in Seattle who had asbestosis and was dying of it, and his shipyard completely denied any responsibility for that. And as I began to understand who was ill and why in medicine, it was a great course in social education. One of the first patients I had was an elderly woman coming home from the hospital. You know, as a sophomore, we would kind of trail behind family physicians, and this family physician tended to her broken hip and then sent me to her home and said, she's being discharged today. I want you to go home and make sure there's some food on the shelves and some milk in the fridge and some eggs, and make sure that everything's okay. So I got to her house, and the cupboards were pretty empty, but I found the shelf full of cat food.
Wow.
And later I told her, I very awkwardly, that I couldn't find her cat anyplace. And there was a really awkward silence. And she said, well, I fry that up and eat it. It turns out she was a school teacher, had worked 37 years as a school teacher, and was on full retirement in the state of Washington. And her income in 1974 was $200 a month, and that's what she lived on.
Wow.
And so I would encourage medical students and physicians, by entering your patients' lives, by being with them and understanding their lives, is a great education, and it was for me, and that's what led to my activism.
Beautiful, thank you.
That was quite the example, and the importance of really knowing the lives of our patients to be able to care for them fully. It kind of reminds me of that story of Dr. Geiger, I hope I'm pronouncing that correct, who was the founder of the community health center movement, community health center idea, and he was prescribing with his notepad, his prescription pad, groceries for his patients. And when they would ask him, why were you doing that? He said, this is the medicine that they need. They need food, they need shelter. So your story reminded me of that incident that Dr. Geiger has often recounted. Dr. Clements, I thought I would transition to asking about your work in the human rights field. And I know that you have talked about healthcare as a human right. And unfortunately, our system's not necessarily reflecting that as a human right. Dr. Clements, your work in these organizations, as well as leading the Harvard Center for Human Rights Policy, how do we as physicians combine both of that work as being both excellent clinicians, but also human rights advocates, as you have so powerfully done in your career?
Well, Umar, thank you for that question. You know, I see the human rights regime, and that's what it's called in academia, and that means the local courts, the regional courts, the International Criminal Court, the Universal Declaration of Human Rights, the many treaties that have flowed from that, and there's probably 18 of them now that define human rights, the European Court of Human Rights, the African Court of Human Rights. These are all part of the human rights regime. And I see it as a vast public health system, because I can't think of a single human right that, if you don't improve, isn't going to improve people's health in some way, whether it's their mental health or their physical health. And so I see human rights writ large as just a vast public health system, and a way of working on it that is a universal language that people around the world can understand, and one that cuts across cultures and religions and boundaries of all kinds. And so I have found in my life it's a great framework in which to make change and to advocate for change. And you can often get law on your side if there are statutes that represent those changes that you're trying to make. As many nations adapt international conventions, when they do that, it means their law is totally consistent with that treaty. So whether it's the treaty to ban landmines or the treaty to ban torture, or the treaty on the rights of children, or the treaty on the rights of persons with disabilities, when nations sign and ratify those, they become the law of the land, and then activists can use them to advocate for their patients or to advocate for social change.
That is tremendous. I liked your concept of the human rights as a universal language that can cut across and be understood by so many different people everywhere, and that becomes our universal framework to hopefully address some of these systemic issues and improve health as well.
You know, the UDHR, the Universal Declaration of Human Rights, has been translated into more languages than any document in human history. Wow. And I think that's an example of the reach that human rights can have.
I feel that on the topic of healthcare and human rights, it would be unfortunate if we missed the fact that that we remain the only industrialized nation without universal healthcare here in the United States. And how would you say us as physicians can be advancing that as a human right, healthcare as a human right, alongside using the language of human rights and the Universal Declaration of Human Rights? Is there anything else that we can be doing?
Well, I think that here an understanding of history is very important. In about 1912, the United States came very close to having a national health insurance until the AMA just really crushed it. And then there wasn't another such opportunity until after World War II. In about the period from 1946 to 1948, there were serious discussions about national health insurance at that time as well. And again, the AMA kind of came out strongly against it, had cartoons of a Nazi kicking down a door with a physician and his patient kind of hovering behind the door and say, "Are you going to let big government into your medical practice?" And of course, the Nazi helmet brought all kinds of fears, but that was crushed at that time as well, although we came very close to it. Now, the most recent presidential primaries on the Democratic side, with a number of people suggesting that we need Medicare for all, or Medicare for all who want it, or something of that nature, has been a very important and probably the most robust discussion about this that's taken place for some time nationally. And I think that the pandemic has just exposed exactly what all of those arguments are about. And I think we can't help but come out of this with a better healthcare system, but we're all going to have to work to make it happen.
Mm-hmm.
With regarding how can physicians play a role in that type of a transformative process, I'm just curious about your thoughts on, though, you know, as Umar and I are medical students, and you know, financially, most medical students are not in a net positive situation upon graduating medical school and going into residency, but the physician workforce are some of the top income earners within, I mean, not the very top, but within the top realm of income earners. And what is the responsibility for the physician to navigate these waters and advocate with their you know, financial status?
I don't think that we're going to, and I'm not sure we've ever really influenced things as a medical profession by our financial contributions or our wherewithal. And if you look at the power I think in the healthcare system, it's really not with physicians so much as it is with insurers, with hospitals, with the pharmaceutical industry. It's not really in the hands of individual physicians, but I think that we are, the moment we graduate, given an unearned credibility that we can speak on things before the public, because for the most part, we are trusted. For the most part, we do speak on behalf of patients and not on behalf of ourselves. So I think we can have a very significant voice in this whole process, and certainly in the communities we live can be a very important voice with going on talk radio shows, or doing op-ed pieces, or showing up at city council meetings where these things are being discussed. I think we have an obligation to try to improve the systems within which we deliver healthcare, and a lot of these changes, we may not initiate on the national level, but I think we can be supportive of them, and certainly make sure that there are physician voices in the Congress. I think there's 16 physicians in the Congress right now, and I hear very few of them speaking up about a lot of the terrible things happening within the healthcare system that are a result of the poor and marginalized and people of color being on the outside of the system too many times, or not having the resources to access it.
Well said, well said. And on that note, Dr. Clements, would you have any final words of wisdom for this new incoming class of 2020 medical graduates, and the many more to come? Any final words of wisdom for us?
Well, I often, in my human rights work, I would often speak in churches, because I was at one time the CEO of the human rights organization affiliated with the Unitarian Universalist denomination. And I would close my sermons with something out of the Old Testament, out of Micah, that goes, do not be daunted by the enormity of the world's grief.
Mm.
Love mercy now. Do justly now. Walk humbly now. You are not obligated to complete the work, but neither are you free to abandon it.
Mm.
And that has sustained me in some very difficult times, because it tells me I don't have to carry the full load. I just have to do my part.
Mm-hmm.
And if everybody else does their part, we'll move this thing forward. And sometimes that part is very tedious every day, and I just have to put one foot in front of another. But if I do that and everybody else does that, that's how change is made. So I leave you with that quote from Micah. It's been very helpful to me. I hope it is to some of the students who may have a chance to observe this video.
Thank you so much. May we all live up to those words and remember those words. Those are incredibly powerful. And thank you, Dr. Clements, for such a rewarding conversation. I hope that not only it's not only been rewarding for us, but for the many who will watch it in the times ahead. We wanted to thank you so much again for joining us, and even more so for being a role model for all of us as well. And Matt, did you have anything else to share?
I want to express my sincere gratitude to you for joining us today on our inaugural episode of the Ideals of Medicine organization. And, thank you again for being a role model, and both, in the future as this video may live on, but also in this very present moment right now. And so I really appreciate your time today.
Terrific. And you might mention for students who would like to have more details about practicing medicine under stress, that the book I wrote, Witness to War, published by Bantam in 1984, is easily available, in Amazon, and it's not in print anymore, but gives some more details about the arc of my transition from being an Air Force pilot to being a physician, and explore some of these things in more detail.
Yeah, I would definitely recommend it to anyone watching or listening. to understand this fascinating story. And thank you so much.
Good luck with both of your careers, and I enjoy being part of this initial conversation.
Thank you so much, Dr. Clements.